Let's start with collagen. Collagen, and let me tell you, a good collagen isn't the one that's advertised the most on TV by some older woman who made it popular and has been raking in money selling collagen. I don't know about that collagen. I do know what it's like, but I'm not going to tell you. Collagen has to be hydrolyzed. I have to explain to you what hydrolyzed means. In fact, when I add a collagen-based gelatin to a cell culture, studies show that this gelatin has the ability to help the culture synthesize collagen. But when the collagen is intact, it synthesizes very little, and when it's hydrolyzed, it synthesizes a lot. In fact, when I add a collagen-based gelatin to a cell culture, studies show that this gelatin has the ability to help the culture synthesize collagen. But when the collagen is intact, it synthesizes very little. And when it's hydrolyzed, it synthesizes a lot. So the conclusion is that the collagen I need to provide has to be hydrolyzed. But when collagen is intact, it synthesizes very little. And when it's hydrolyzed, it synthesizes a lot. So the conclusion is that collagen I need to provide has to be hydrolyzed. And then we'll see. That is, well, collagen is insoluble in water. It's a protein that when I heat it, breaks down and eventually gets destroyed. When I heat it, I form a gelatin. Okay? I can enzymatically cut that heated gelatin, obtain peptides or polypeptides. It's difficult to obtain amino acids, but I get the fundamental fragments that make up proteins. So in the end, I can obtain small fragments of peptides, and that is hydrolyzed collagen. So if there's data showing that the intestine can absorb molecules smaller than, say, 500 Daltons, it's important for me to ask the manufacturer how many Daltons their collagen has, because if it exceeds that amount, or a very significant percentage exceeds that amount, then that collagen might not be very interesting to me. Yeah, okay, we can ask ourselves two things. Hey, do they reach space? So do the active ingredients get where they need to go? Because that's what it is. People tell us we're pseudoscientists because you're just giving spring water and that doesn't get where it needs to go. Let's see if it's true or not. The concept I mentioned earlier that can be evaluated radiologically is the disease-modifying effect. So let's start with the first one and see what we find. And the drugs that have the ability to modify the disease are called DMOs. In English, in other words, these are the ones where when I do studies using radiological techniques, besides seeing pain, blah, blah, when I also include radiological techniques in the study, I observe the space. If the space is maintained over time, I can conclude that this active ingredient is a disease modifier because it's not degenerating any further. You all are here, right? For example, studies done with chondroitin, in a meta-analysis with 4 studies, it is shown that chondroitin sulfate slows the speed of narrowing. It's a disease-modifying drug in itself. Clinical trials suggest that starting from an initial width of 2 millimeters of the space, treatment with chondroitin could prevent that space from being reduced by half in 10 to 14 years. In other words, there are parameters to determine how far I allow that space to go. Other studies indicate that the conclusion is also that space is maintained. And the same happens with glucosamine, meaning that glucosamine sulfate reduced radiological progression over a period of 3 years. This is very important. This is very important. And they arrive at the site. Well, studies indicate that when I take hydrolyzed collagen, the pancreatic enzymes also take care of digesting it. But I observe concentrations of proline in the blood 1 or 2 hours after ingestion. Others, but I can also mark it. Can I mark the amino acids with reactivity? I put an isotope on it, mark a chain, and then I ingest it, and I can do like a fish, right? Like a CT scan, I don't know what it would do. I can visualize where I have the radioactive mark, and then there are certain studies, this is one of them, where it can be seen that 12 hours after ingestion, these marked peptides can be found at the site, in the joint, in the cartilage. So that would be conclusive evidence that the active ingredients I ingest are indeed reaching the site where they need to go. Is this something like probiotics, right? A probiotic, the best probiotic in the world, is the one that reaches me where it needs to go, which is the intestine. That's the best probiotic. The rest is all nonsense. Of course, the hydrochloric acid in the stomach, along with the enzymes, the gloves, they make sure it doesn't get through. But if I have a probiotic that I set up in a way that it reaches me, that's perfect. All of that has been studied. Sources of collagen, well, I have type 1, type 2, type 1 and 2, and type 2. Well, if the bone, tendon, and ligaments are type 1, then let's look for those that are specifically type 1. And if the cartilage is type 2, then let's find those that are type 2. The most important thing is that it's hydrolyzed, but within that, I might be interested in type 2. If, for example, the trachea of chickens is very rich in type 2, then there will be products made specifically or solely from chicken trachea. It's unfortunate, but that's how it is. Of course, if I'm really interested in, for example, looking good, which is complicated because of the dermis I have, I might be interested in fish collagen, but maybe not so much for a joint. Then there are issues like with bovine and porcine sources. Manufacturers, well, if they sell in Morocco, they won't make these types because they can't consume, I think, pork. Also, remember the mad cow disease era, where anything that came from that was a problem, so fish became very popular. But be careful with fish, because I can take it from the cartilage or I can take it from the skin, so depending on where I take it from, I have more type 1 or more type 2. The salesperson usually doesn't tell me that, basically because they don't know either. The advertising on the cover, I have to mention, they're not brands, Jorge. The thing is, the brands that I cover up, when we're looking for a good collagen, we need to go to suppliers. I can say that, no problem. Well, I've listed the ones I know, especially these two, Peptan and Fortigal. As a laboratory, I have to go with one of these brands, because in the end, it's like with probiotics, where there are 2 distributors across Europe. And what the brands do is pick their choices, but it's all been figured out. And here it's basically the same, meaning Salud, Solare, Intersa, whoever. What they do is, if they want to, well, if I want a good collagen, I'm going to go, for example, to Peptan, to Fortigal, to such and such. Why? And here it's basically the same. That is Salud. Solare, Intersa, whoever, what they do is, if it's appropriate and if they want, hey, well, if I want a good collagen, I'm going to go, for example, to a Peptan, to a Fortigal, to such and such. Because when I buy these collagens, my supplier gives me clinical trials of their collagens. They tell me, mine is hydrolyzed. You have it from sources, fish, bovine, and so on. And also the clinical trials I'm talking about, for example, with Fortigal, it says that Fortigal, well, of course, Fortigal is going to tell you that their collagen, which is from Pouture de Foie, of course, is a good collagen. Peptan is going to tell you the same thing, right? Watch out, because we're all at 10 grams. We're all at 10. Peptan is already at 8. I think we're going to go lower, right? Of course. Because I asked why 10. Is this something like this? Because once I asked an oncologist, hey, why do you tell them to take tamoxifen for 5 years? No, because those who started with tamoxifen said 5 years is the period. And why not with 3? No, the other way around, going towards 7. Why is it interesting to consume, but why 5? Why 5 years? Why 10? What does Peptan tell you? Well, the parameters tell you that it reduces pain and increases the structure of the joint. So perfect. I'm sharing this in case you want to check out these studies. So you're not going to buy anything here. This is so you can see if, for example, the medical representative from blah comes to you and you want to ask, hey, where is your collagen from? And you burn it or see it in a jar. Hey, I'm mentioning this for your information because with Fortigal, with Peptan, what is this? This is this. This means that the collagen you are using or prescribing or buying is coming from these people who provide you with their studies. Also, be careful with the studies from all these people, because like I'm doing today, I'm sharing the studies that are positive, obviously. Because look, published in a journal, I'm sharing this article from some Spanish colleagues Because after reviewing the studies, there's one study that I think is very recent, just a little while ago. And they conclude that collagen does positive things. However, these people are linked to a commercial brand, and this led to an immediate response from some rheumatologists from near my hometown in Alicante, Villacolosa. Alejandra, you go there too, right? Quite a bit, where they say, hey, don't get too excited. It's a study sponsored by the industry. But still, based on everything mentioned earlier, they say it seems there could be a beneficial effect of blah, blah. So you see how we're already starting with the controversies. In any case, and then I'll continue with them, the dosage of collagen. There are old studies from 11 years ago that say between 1500 and 2100. I have experiences with collagens around 1 gram that work great, really great, especially because we might add some silicone. However, we are all here now. Almost everyone is handling 10G jar dosages. The latest studies suggest 8, like the one we saw earlier. Collagen is expensive, reduced to 8. Offer a better price by using 8. Studies show with 8, we get results similar to 10K. We'll see a drop to 5, managing collagens with more elements. Difference between shark cartilage and collagen. And I'm convinced, let's erase this, because it's my intuition, that soon we're going to see a drop to 5, managing collagens combined with more things. What's the difference between shark cartilage and collagen? Do you remember when shark cartilage was all the rage? Shark cartilage became very trendy. Everything was being sold, and now it's collagen that's being sold. What's the difference between one and the other? The difference between collagen and cartilage is that collagen provides collagen, whether it's type 2 or type 1 or whatever, while cartilage, when I take the cartilages from squalene, what I'm getting is type 2, collagen, chondroitin, calcium, and phosphorus. In theory, it's more complete. It's possibly less concentrated, but it's more complete. What's going on? It's commercially outdated, in my opinion. Why? Because what's really commercial now is collagen. I remember something about shark cartilage. I pursued it over 20 years ago because I was really interested in one very important thing about it, which is that they said it inhibited tumor angiogenesis. This means that for the tumor to grow, it needs blood vessels to be able to grow. So there are already antineoplastic therapies like Avastin, which works by cutting these blood vessels. The natural analogy would be shark cartilage, because proteoglycans also have a certain ability to inhibit this process. I'm telling you this because it leads me to, even though I always tend to talk about little things related to cancer, I'm mentioning it because in advanced osteoarthritis, it corrects less ANA. There comes a point where the body resorts to neovascularization, and that causes pain. So, in advanced osteoarthritis, where I might be interested in preventing that process from happening, angiogenesis might be important to me. So, the cardiologist might be interesting for me. There are double-blind clinical studies with 140 patients that show a reduction in pain. And well, there are studies that indicate it also significantly reduces pain and blah, blah, blah. The dosages, you can see them here. Basically, you're going to follow the dosages from the manufacturers.